morning and welcome to our UBC Learning Circle. Healing happens here, decolonizing primary care through Indigenous land-based health programs in urban spaces with Vancouver Aboriginal Health Society. Today's conversation is presented in partnership with the Center for Excellence in Indigenous Health. We'd like to thank the First Nations Health Authority for generously funding the UBC Learning Circle and allowing us to have these conversations. Before we formally begin, I'd like to acknowledge with respect and gratitude that I'm joining you from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Please feel free to introduce yourselves and the nation you're calling in from in the chat box. Today's Learning Circle will be exploring Healing Happens Here, decolonizing primary care through Indigenous land-based healthcare programs in urban spaces with Vancouver Aboriginal Health Society. I'll ask our panelists to introduce themselves in just a few moments. For those of you who don't know me, my name is Skszwx. I'm the Learning Circle Manager. I'm SælilwətaЛ on my mother's side and Higria, Apache, and Belgian on my father's side. And I'll be your moderator for today's discussion. And joining us working behind the scenes is our production assistants, Kira Lumley and Nicole North Pagan. They will be in the background interacting with everyone in the chat. And finally, before we get into today's discussion, I'll provide a gentle heads up that the topics covered may be sensitive or emotionally triggering. Please make sure that you are looking after yourself, and if at any point in time you need to talk to a friend, elder, counselor, or family member, don't hesitate to do so. We have some prompts in the chat for you if you need additional support. Now I'll turn it over to our panelists to introduce themselves.
Cool. Skszwx, Marlee Poole, much of the Sţwx, la Riviera Rouge, Oceania, Maka Vancouver, P. Musqueam, Squamish, Tsleil-Waututh, Niwikwin, Ikwa. In my poorly pronounced Michif, I just introduced myself as Marlee Poole. My pronouns are they and she. I am a Two-Spirit Métis person living on the traditional stolen territories of the Musqueam, Squamish, and Tsleil-Waututh people. And I've been here since 2013 on these territories and with Vancouver Aboriginal Health Society since 2020. It would help if I shared my screen, so I'm going to do that. So yeah, as we said, absolutely feel free to introduce yourselves in the chat. I won't be able to read or respond to everything in the chat as I present, but it's really exciting to know that there's so much mutual interest in this topic, and I'm looking forward to engaging with folks during the session, because after all, this is a learning circle. It's not just me talking. I want to, have this engagement and have a really a safe space, but also a space of learning and growth for everyone involved. So there we go. My screen should be visible now. And let's just move that over here. And yeah, absolutely, take care of yourself in the way that you need to. Just given the gravity of this topic, it is a big reality for a lot of us. So I just want to know that folks feel safe to be here. And yes, this is going to be recorded. So if you need to step away, and don't worry, you can always watch this again later when it's published. So don't feel like you have to stay in the session. That's important for me to let you know. And I think that's what I had to say there. So I'm gonna get started with a quick introduction to myself, because for me, it's important to situate where I am and who I am, because it definitely influences my approach to this topic and the work that I do. So I am Métis through my mother's side and European English settler ancestry on my dad's side. My ancestral roots are in the Red River Métis homeland, specifically around the St. Andrews, St. Clement's parishes in what's outside the city of SælilwətaЛ. I also lived in SælilwətaL for 10 years, was born in northern Manitoba on Treaty 5 adhesion lands, and then moved to this area for the latter half of my childhood. And I'm the 9th generation of my direct family line to have lived in this area. So that's that's part of my home, but I've also, since living on these territories as well, I've basically split about like a third of each of my life within 3 different territories. So home means a lot of things to me, and I'm grateful to also be part of the urban Indigenous community and call here home as well. So in this slide, there are 6 generations of my family present here. I joke that, well, including myself, but I joke that if you include my cats, I guess that's 7 generations. So I call them honorary Métis in their own way. So for me, I definitely approach my work just rooted in my experiences as a Two-Spirit person, as a Métis youth, as a neurodivergent person, as someone who strives towards the good in people, and someone as that really wants to honor kinship and responsibilities to all of our relations, as I note here with several of the Cree and Michif values that are close to me. So that is a lot of that's where I'm grounded in. And I just wanted to share a little bit of me, because that is very much integral to how I approach this. When I started at Vancouver Aboriginal Health, it was during my master's program as a practicum student. For me, I was looking for ways to influence urban Indigenous health from a policy perspective, and wanted to be grounded in a place with a long grassroots history, which is why why I wanted to come here, and why I'm so grateful that I was able to come into this space, and then also continue after my education in a growing policy role. And to my knowledge, I'm the first person to hold a policy role in the 30 years of this organization. So I hold that with a lot of responsibility as well. And I do want to share, of course, that what I'm sharing is based in my own knowledge and my own perspectives. I'm not representing everyone at the society, but this is my take on a lot of what's happening in our communities, and what I think our approach is really doing for our community as well. So switch over here. Just to introduce Vancouver Aboriginal Health, we used to be called Vancouver Native Health Society, so you might have known us as that in the past. We changed our name just before the first wave of COVID, actually. So we've been around since 1990. We started primarily as an after-hours medical clinic to respond to the lack of primary care services, specifically for urban Indigenous people, especially within the Downtown Eastside and surrounding communities. And eventually, a lot of our focus shifted to responding to the increase in HIV in our communities, especially in the mid to late 90s. And progressively, over time, we were able to introduce more programming, including our Indigenous early years programs, which have been around for, I believe, over 20 years now in our organization, as well as our dental clinic, which has, I believe it's in its 14th year of running, and offers full service, low barrier dental care, and our cultural program as well, which in its current version is only a few years old, but we've always had culturally grounded services and elder supports within our organization. It's just in its current programming, the structure in itself is relatively new, but it has been integral to our work for a really long time. And we have a lot of exciting initiatives along the way as well, including our Women's Mobile Primary Care Clinic, which is hopefully set to launch in early 2023, as well as our new healing center, which is going to be just a few blocks down from us. We're currently on the 400 block of East Hastings, most of our services. So we're moving to, I guess, the 0 block of East Hastings from 52 to 92. And that's going to be a partnership with Luma Native Housing and Rain City Housing, where we're going to be operating a 3-story Indigenous Healing Center, and they are going to be having like individual and family units attached to the center too. So we're really excited about that. So we're going to be able to expand our current capacity and then also introduce permanent indoor and outdoor ceremonial spaces, like our ability to grow and serve our own foods and medicines, as well as have a pharmacy that includes traditional Indigenous medicines within it. So we're really excited for that and look forward to continue to grow after 30 years. I included our vision and mission here because this is relatively recent. We updated this last year during our strategic planning. Previously, it was a lot of focus on wellness of like the individual, but we wanted to update and shift our approach and have that be better reflected in our vision and mission, that we are really about the community, especially because wellness in one person extends to the family and extends to the community. So that is really integral to what we do. And we also are working under what we're calling our system of care framework, which is what I helped develop over my master's program. And that is a framework that really works to have our services in all of their forms be rooted in cultural knowledge and cultural protocols, so that we're not just trying to indigenize primary care or social services, but actually have like Indigenous systems of primary care. And I'll talk about that difference too, because yeah, that's a big part of like what this conversation is going to be as well, is that difference. So without further ado, I needed to write this out because this is really like a big point that I wanted to share, and I didn't want to forget the exact verbiage that I had in mind. But our organization has to exist because of colonialism and its ongoing impacts on the health and wellness of our people. We believe that truth and reconciliation cannot happen until Indigenous people everywhere can heal and thrive on our own terms, free from the violence of the systems that still work to erase our autonomy, cultural practices, and ways of being. So you're going to notice I have several King of the Hill memes throughout this. I'm on a personal journey of trying to watch every King of the Hill episode in order. And I realized that like some of it is like relevant to the discussion, and you'll understand why. But this is the first of many to come. But a few guiding questions that you've probably seen already when you registered, but we're going to talk about what land-based healing practices can look like in cities, how they connect to systemic changes, including land back needed for Indigenous communities to heal and thrive, and how has city planning as part of colonial nation building created health inequities by disconnecting urban Indigenous people from the rich histories and medicines of the land. And we're kind of going to start with the last question and move upwards. And it's a lot to discuss, and it's going to be fairly broad in scope as a result, but it's important to kind of for me to make those connections. But a lot of these could be their own session in themselves. Yes, of course, I had to have John Redcorn represented here, best character in the show, personally. So we're going to start with the roots of what we're talking about, because we can't talk about Indigenous health and wellness, especially in urban settings, without talking about the creation of the colonial state of Canada, and specifically how that lays out in cities and policies, and how policies are enacted in cities as well. So we start with key acts of discovery, so-called discovery and displacement, with the doctrine of discovery as really like one of the first examples there. This gave Christian explorers the right to so-called lay claim to lands that were not already claimed by Christians. All of that in scare quotes, obviously. And then, over time, we get to the Gradual Civilization Act, which worked to assimilate Indigenous people through enfranchisement, This act was actually a resounding failure. I believe only one person actually enfranchised under this act, but this act ended up leading the way to the Indian Act. But before that, the British North America Act, part of the creating the Dominion of Canada in 1867, expanded British and federal control over the French colonies, as well as like lands reserved for Indians, as was called. And then, 9 years later, we lead to the Indian Act, which lets the federal government govern the day-to-day lives of so-called registered Indians, leading to the reserve system and the pass system along with that, and everything within the second box, as we see. And that is important when it comes to cities, because systems like the reserve system, as an example, are an active form of displacement in order to make way for like settler cities to be built. So that's that's core to the creation of the city, is that active displacement of Indigenous people from the land, so that the land can be extracted and built for settler purposes. And then this leads to what I call policy failures, but of course, like, they are policy failures because they fail to meet the basic needs of everyone in our society. But it's also something to say when it comes to policy failures that this was intentional, and these policies exist for a reason. So in a way, they succeed at what they're trying to do, but they are failures because the goal of public policy should be to support everyone in our community, but our policies fail to do so. So we talk about legislative poverty, we talk about the housing crisis, especially in cities like Vancouver, but really everywhere. We're talking about policing and institutionalizing, especially in the ways that policing is seen as the solution to health, health within our city, especially in regards to mental health, and the reality that policing as we know it did not exist on these lands until the creation of the Dominion of Canada, and how the RCMP and then eventually municipal police departments that have been created to police people's identities, to institutionalize and displace people based on the creation of the identity of Canada and the identity of that specific city. Child welfare, obviously, welfare again in quotes, the ways that our children and our future generations have been disconnected from our cultures over time, as we've seen and as we continue to see. Food security and sovereignty, definitely a major part of what it means to want to practice land-based healing, and just cultural practices in general in the city, is our access and sovereignty over the food we're able to get, especially traditional foods from our homelands, as well as medicines. I include plant medicines in this as well. So, the creation of food deserts, and just lack of access to affordable and healthy foods in our cities is a major reality and is an intentional policy failure. Healthcare and social services and the entire system and bureaucracy is rooted in settler priorities, and intentionally excludes people who don't meet the standards of identity within the city. So, and then of course, leading to the drug poisoning crisis and drug prohibition, which is not just limited to anti-Indigenous racism. We have seen the legacy of drug prohibition throughout the history of so-called Canada on many racialized communities. When wrote this here, I'm thinking especially of how Indigenous folks are disproportionately impacted by the drug poisoning crisis, and how not doing anything about the so-called public health emergency that has existed for almost 7 years now, with over 10,000 lives lost, is a political choice. It is by intent and design to continue this crisis because it is a choice to let it continue. So, and all of those things have roots in the first box here. So I will, but I wanted to write here as well is that, of course, like we cannot prescribe our way out of systemic violence or any of the things listed here. We can't think of any of these things as solely health issues, and specifically like health issues within individual people. These are all part of the social and structural determinants of health and wellness, and they are all intentional in design, and they are all choices. But the thing about those is that they can always be changed. So we're going to talk about that. So going a little bit deeper and thinking about the construction of the so-called inner city, and I'm mainly focusing on the Downtown Eastside in Vancouver, just to situate us right here. Again, the result of intentional planning decisions, particularly within the Downtown Eastside, is the creation of the neighborhood is as portrayed in the media and otherwise is the result of folks being displaced from other areas of the city, and basically being displaced right into the Downtown Eastside neighborhood. We saw this especially during the Olympics, and we continue to see this as well with the constant displacement of tent cities, as well as the intentional policy decisions to only have, say, like social housing and supportive housing, and other services like within the Downtown Eastside and not elsewhere. The idea that like we can't exist outside of like this specific space because the rest of the city has like so-called been neutralized as like a settler space, and not a place for like poor folks, Indigenous folks, drug users, sex workers, all of these things, right? So yeah, that turns into the regulation and policing of these like so-called dangerous spaces, the construction of people as addicts that removes that agency and that autonomy over our wellness, over again every part of our lives, and especially in the Downtown Eastside with the over policing that takes place, and the idea that policing should be like the primary part of the so-called like safety net of Vancouver is it's a process of colonialism in itself, because we like the idea that our communities need to be policed and we need to have like a carceral system rather than a care system for people. That definitely has over 500 years of colonial roots attached to that. So that over policing and like institutionalization of people reduces autonomy and humanity within the community, as seen from like outsiders of the community, which are constructed as like the general public. So when we think about poverty as well and how that takes place and how that is like most visible in inner cities, thinking about how poverty is medicalized and viewed as like a mental health issue, as an example, or poverty is just heavily criminalized due to the completely unsafe poison drug supply. Just existing in public is criminalized because if you're unhoused on the streets, apparently that's criminal, according to our cities. So just the the ways that poverty is, seen as like an individual medical issue or a criminal issue, and not, the result of policy failures and ongoing political choices, is a big part, especially within the inner city, but really everywhere too. The concept of forcing supports is a big part of life in the Downtown Eastside as well. What we really try to do as an organization is have, that abundance of access and self-determination within our services. We don't want to enforce anything onto anyone, because otherwise, like, we are enacting the same colonial systems that we are trying to change. But the idea and the practice of institutionalizing people, whether that be in jails or hospitals, especially psychiatric hospitals, is a big reality. Yes, I'm gonna side eye the new premier as part of that too. But yeah, I think especially too, going to the Mental Health Act and Section 28 of that, the section that gives police the right to determine if someone needs to be institutionalized in a healthcare setting. That decision going to individual police officers and completely erasing the autonomy of the person in crisis. Yeah, I think about things like that when it comes to forcing supports, but as well as like forcing a like colonized system onto a person, like when that might not meet their needs or their aspirations. That's also part of that too. And then lastly, when it comes to complicity, that is basically because every system involved is so broken that makes everyone feel like they aren't accountable to it, as well as because the inner city, like a specific neighborhood, is constructed as like the dangerous space, then everyone else within the city like doesn't actually see their issues in their own backyards as well. So it assumes that these issues are only taking place in like the Downtown Eastside, for an example, but like it's happening everywhere. But just because of like how inner cities are constructed as a result of like city planning, then that especially causes harm to the people in these neighborhoods as well as elsewhere, because services aren't being reached to like other neighborhoods too. So it creates a very inequitable city in that way as well. If any of that makes sense. But I do recommend these two pieces as well for further reading. These two readings have really influenced the ways that I conceptualize a lot of this. So, and of course, thinking about colonialism as the root of so many systems of power and issues that affect all of us, not just Indigenous folks, of course. Colonialism having being rooted here and then leading to different forms of supremacism, leading to capitalism, especially the way that capitalism is enacted within cities as a place of like industrialization, urbanization, and how that all relates to our health and wellness within cities. So we think a lot of the time when it comes to health in terms of our productivity, when health, as we think of it in like biomedical terms, is often with like individual issues within our bodies that will that impact the ways that we're able to be productive within the city and within like a capitalist structure. So, if you're physically unwell and unable to work, as an example, or you're disabled, or there are like so many other circumstances in your life that make living under a capitalist system like less possible. And capitalism is like only meant to support like the absolute most wealthy and powerful within our society. So it is completely valid to not feel like you can survive under the system, but it gets increasingly more challenging, of course, for when our health and wellness plays a factor too, and how capitalism also like worsens our health conditions as well. Like it's so structural in that way. And that's really related to colonialism too, because the building of like settler cities and settler nations is a lot about like extraction of resources, extraction of labor, extraction of power. So when we can't like physically or mentally like exist under that kind of system, then health is just viewed as like, you know, band-aid solutions so that we can like participate in capitalism rather than like being well for our own like wishes and aspirations. So, and assimilation for access, what I mean by this is just the ways that identities are formed within cities, how cities are built for and designed for specific people and specific communities, and to displace everyone who doesn't fit like that idea of who the city is for. So, and in order to access like resources or services or really participate in the life of the city, you have to like assimilate to this idea and like these practices. So obviously there are colonial roots there, supremacist roots, and capitalist roots as well, that shape the idea of like who should be in the city. Individualism I put here again because our health and wellness is often viewed in, again, that biomedical idea that it's individual issues within our individual bodies, and our ability to like participate in these systems is like kind of how the health system operates and works to like treat you. And as well, when it comes to living in cities, the idea of individualism under a capitalist system is that, you know, you work to support yourself and like your immediate family, instead of models that, or, you know, practices that work to support your entire community. It's very much like focused on meeting your own needs and the needs of, you know, the people immediately around you, but not working to like support the better of the community and the better of the city, and especially like support the folks who are most vulnerable within our society. Moving into environmental racism, we see this everywhere, but in the ways that cities especially are planned around being like very car-centric, being very focused on like industrialism. We like forestry is still the #1 like economic sector in Vancouver and a lot of British Columbia as well. So just thinking about like, you know, extracting resources from the land, as well as like the ongoing continual worsening climate crisis, and how racialized folks and poor folks in particular face the largest impacts of environmental racism and the impacts of not being great to the planet in favor of the needs and goals and wallets of people most in power. And lastly, thinking about disconnection from the land in a general sense. So this kind of goes into the idea that like urban spaces cannot be places for land-based healing, that you have to like be away from the city in order to have a connection to the land. And this is definitely something that I felt personally as I was trying to just like have a better connection and understanding to what like land-based healing means to me, as someone who like doesn't drive and is like unable to either like physically access spaces for healing, or just like having assorted other barriers to that in my own life. It took a long time for me to kind of unlearn what it means to really connect to the land in urban spaces, and especially just like considering that we still are on unceded territories, like within urban spaces, like that doesn't mean that we're not connected to the land. We always are on the land, and we are the land as well. Just a question about accessing the PowerPoint after. I don't intend to share the PowerPoint on its own, just because a lot of what I'm saying isn't written down here, but the video will be posted later. So the PowerPoint will still be visible in that way. I just don't think I'll be posting the PowerPoint separately. So leading into healthcare specifically now, colonialism and its associated policies have led to the following and more impacts when it comes to Indigenous healthcare, centering Western credentials and systems. So of course, like devaluing Indigenous health systems, Indigenous healers, and Indigenous knowledge. Of course, like the ongoing presence of racism, discrimination, stereotyping, and stigma. Again, not just limited to Indigenous people, but we know about the specific presence of anti-Indigenous racism within the healthcare system. Yeah, credentialism sucks. But when all of those credentials are just focused on like Western practices, then that eliminates so much of like what is possible within healthcare, and particularly primary healthcare, which I'll talk about later. Colonialism leads to a focus on disease and ailments rather than on our whole person and our life circumstances. So again, focusing on like individual issues and like medicalizing the determinants of health as they play out in our bodies. Rushed appointments and time boxing is part of that too, because when especially in Vancouver Aboriginal Health, what we really try to focus on is relationship building and having those like ongoing long-term connections in our care. But when you're limited in the healthcare system to like a 10-minute box, then how are you supposed to really like build those connections with the providers, especially when you can only see them like, whenever you can get an appointment, or even if you have a connection to a primary care provider at all. So that's a whole other thing. Yeah, that doesn't leave that space to really focus on the whole person as well. And again, that like reinforces the idea is that like you only go when you're in that like crisis situation, or like you need like an individual issue in your body resolved, rather than like primary care as a space to like support your entire wellness and have that be more of like a proactive thing in our lives. Colonialism leads to power imbalances between the provider and patient. So this is where a lot of the harm happens, not only physical harm, but also just the ways that like we experience navigating the healthcare system, and a lot of the bureaucracy that is part of it too, is just that relationship and difference of power between like who is providing the care and who is receiving the care. Lower quality of care in all of its forms is an impact of this. Again, like not really seeking care unless there is either an emergency, or if like that individual issue that is playing out in your body as a result of like everything around us gets like it becomes like so much to handle that then we feel like we need to access healthcare in some ways. For a lot of people, that's going to the emergency room, and we may not necessarily have to. And a lot of that is a result of, that fear and mistrust of the healthcare system that a lot of folks experience, again, not just Indigenous folks, because the system is not set up to really support our wellness in so many ways, that a lot of people just completely avoid the healthcare system entirely until it's absolutely necessary, and sometimes not even then. And again, leading to preventable disease and death as the impacts. And we know this reality of folks dying in hospitals from completely preventable deaths, or just not being able to access healthcare or services at all. Especially like in so many ways that are like beyond what we can discuss here today, but just thinking a lot about those stories and holding those close right now. But yeah, and this is just like some of all of these impacts. Like I can't even list all of them here, right? And in Indigenous healthcare specifically, especially in urban settings, there's what I call this like jurisdictional journey, because it really is a journey. So thinking about barriers to resources, autonomy, and sustainability when it comes to urban healthcare providers, thinking of like organization I'm in as an example is like we are kind of in this like jurisdictional space where, you know, we receive like some funding from some spaces and like some levels of government, but then there's like divisions in like which level of government handles like which thing. We see this in the ways that like, you know, only like folks with status can access like some services. For me, speaking as like a Métis person, I can't access certain things, and it's just like it turns into like this weird division of like who is able to access services versus like who isn't. And a lot of that is also grounded in just like, you know, the decisions of our levels of government about like who's going to handle what. I'm just going to quickly plug in my laptop so we don't die mid-session. There we go. That would be bad. So with urban organizations, we also kind of experience this like inability to have like sustainable ongoing programming, because like a lot of what we want to do is based on like funding and policy priorities by the government of the day, whichever government is handling what at the time. And a lot of these priorities as well are really focused on like a deficit lens. So it's a lot about like, oh, you need to like solve this issue within your community, rather than like, we're going to like help support you to lift up your community. It's a lot of like, you need to fix these deficits rather than like focus like on your community's wellness in that way. So yeah, so there's, you know, barriers for us to be able to deliver our work based on just like our status as an urban Indigenous nonprofit clinic versus like other spaces. And we're not saying that like we want to take away like resources or funding from like anyone else. If you think in like improv terms, we're not saying no, we're saying yes and because there should be like resources and funding for all of us to do the work that we need to do, whether we're in urban spaces or on reserves or in rural areas. But it's a lack of political will and intentional political choices that make it impossible for all of us to like fully support our communities in that way. Again, like going into bureaucracy with the different jurisdictions of Indigenous healthcare and just like system navigation in general, it can be really challenging to like access services. And I think this is idea that because you're in an urban space there, and because there's a larger quantity of resources and services, that like your experiences will be better, but that's not always the case, especially with like the prevalence of, you know, anti-Indigenous racism and all of the structures that define everything that we do and how everything works in cities. But also for us as like healthcare providers, the amount of like bureaucracy that we have to navigate to in order to provide like basic culturally grounded care. One example I can think of is like the amount of time we had to spend working on getting a permit for health fair that we did in Oppenheimer Park a couple of months ago, just to have like a fire, like a small fire to cook salmon in the middle of the park. The amount of like steps and paperwork and time that it took to even just like have that basic cultural practice on unceded lands because of like the bureaucracy of the system is it's a lot. I won't speak more on that, but that was a whole thing in itself. And so that's just one example of like, you know, how to like trying to navigate like the bureaucratic systems of cities as like a healthcare provider, but like even especially as a patient is very real. And lastly, just thinking about the incorrect perception that urban Indigenous people are transient, but yet our culture is being static, which doesn't make any sense. So thinking about like cultures as like only like limited to the past and not thinking about how our cultures like grow and evolve over time, I think is a major misstep when it comes to people who are in power of Indigenous health and wellness systems, is that I think there's like, they're not thinking of us in urban settings as like being alive spiritually and culturally, and how like we have grown over time because we've had to be resilient, but also because cultures themselves are not static. So that's an important thing, because yeah, there's this idea that like urban Indigenous people do not call cities home, when that's completely false. Like I believe 80% of the Indigenous population throughout Canada lives in some sort of urban space, whether that be like a smaller city or a like metropolitan area. So the reality is that like cities are our home. We are directly connected to cities, especially too for like folks whose traditional territories are in cities. It's a weird misunderstanding of like the idea that homelands can only be on like reserves or like away from city spaces. And that definitely impacts like services and resources that are given to like urban Indigenous organizations, as well as urban Indigenous communities themselves. So I forgot I added this photo in here actually. This is from the King of the Hill episode, where Hank is trying to open a door, but he can't get it open. So he gets out a can of WD-40 to kind of try to loosen the door, but he can't get the can open. So he gets a smaller can of WD-40 to like open that can. And I think of that about like trying to fix colonialism by doing more colonialism. That's like the connection I made. I made this slide at like 1 a.m. I'm not gonna lie, but I just want to think about like reconciliation and how that tries to be enacted in Indigenous healthcare, and also just like, you know, thinking about like truth and reconciliation and how different levels of governments are trying to like reconcile with us, even though like we were never in a good place to reconcile to begin with. The idea of cultural competency training, especially within healthcare, is a big part of this. The idea that if we just shift individual behaviors in how we think about Indigenous patients, that the whole that's going to be solved, right? And like cultural competency being used as like a tick box approach, and really not being evaluated afterwards to ensure that like behaviors or organizational changes have actually taken place afterwards. And also like cultural competency is kind of like this one size fits all approach that's used throughout the system, and not like rooted within the context of like the lands that you're on and the communities that you work with. So that in a way it really needs to like be more contextual and more relational in that way to actually make a difference. So, and then, you know, really cultural competency doesn't address or dismantle like the actual system as a whole. It needs to be part of the process. And I'm not saying that we shouldn't do it. I think it's important to at least have that aspect within it, but it can't be the only solution. And the problem is that that's kind of being seen as like the solution, right? So again, like thinking about racism in the healthcare system, it's not merely the actions or inactions of individual staff, but like the privileging of Western approaches to health that inherently create barriers to health and healing for Indigenous people. And And some of these barriers come through infinite consultations, reports, pilot projects when it comes to wanting to create reconciliation. The idea that this has to be like constantly constantly researched, constantly reviewed and reported, usually not by Indigenous peoples themselves, by the way, in order to have like action plans for change, when like, you know, people in power have been told for many, many years of what needs to change. But no, we got to go back to the drawing board. We got to write another report. We got to do another pilot project. But in the name of reconciliation, right? So that definitely slows the process and the progress, as well as like focuses on incrementalism and, you know, just little tick box approaches rather than like the broad structural change that needs to happen. Reconciliation without truth is a big part of like these structures, not really taking accountability for all of these systems at play, not only like historical systems, but their ongoing impacts, as well as like new and evolving ways to colonize Indigenous folks. So there's that. Harm reduction versus harm elimination I have here, because again, a lot of what we have to focus on in the healthcare system in particular is harm reduction, which of course we need, and given the realities of, say, like our drug poisoning crisis, our housing crisis, all of the crises, and that has to be our focus in our work, and not like eliminating the harms. It's just constant, like, you know, we're going to implement this thing to, you know, support folks, but not actually like change the system so that we don't have to keep having these like harm reduction approaches, right? So that's part of it. And lastly, thinking about indigenizing systems and not Indigenous systems. I think that a lot of the work when it comes to Indigenous healthcare is thinking about like how can we help like bring Indigenous like representation within the healthcare system, or, you know, how can we like try to like fit in cultural practices within primary care as we know it. And there's that kind of approach, rather than just like, what if we actually had a system that was grounded in Indigenous values and practices to begin with? Because really it's like we're almost like tokenizing Indigenous health in that way, rather than like creating a system that actually is like grounded in the teachings and practices of this land and understandings of health and wellness that have been here since time immemorial, right? So it's a lot of that too. I included this quote from xʷməthkվəy and K-Wang Yang here from Decolonization is Not a Metaphor, because I think a lot of reconciliation works too is just like the idea of settler moves to innocence come with like when decolonization is used as like a metaphor and not a literal practice, and the ways that like there's work to not make people feel complicit or accountable in the system. It's the idea that like, oh, I did the work to like, I took the cultural competency course, like I can do a land acknowledgement, like and then like not doing anything beyond that, or like actually changing the system in any meaningful way. So that's a, you know, that's a big part of that. Read this article, please. So this is the meme that I made. I apologize for this one, but now I want to think about land back, and specifically because land is viewed, especially in city building, as a commodity and something that is like needs to be extracted and exploited for like industrial purposes, colonial purposes, that we need to understand that we are the land and the land is us. And land back is not, it does include literal land. I need to it is literal, but it also includes all of our relations when we think about land back. And when colonization began in so-called Canada, those who led this process understood that generating wealth and power, including in cities, could only happen if Indigenous people were separated from our kinship with the land. Again, land back is more than just land in the physical sense. It is the reclamation of everything stolen from Indigenous people through over 500 years of colonization. Yeah, so when we think about land back too, a lot of pushback that comes from like, you know, settler institutions and even individual people is like, what about my house? Like, can I live here? And it's like, well, yeah, like, but if that's your focus, then like maybe reflect on that. But that really ties into the idea that like land and private property are like interconnected, and that like private property is like a thing that should exist on unceded territories, or, you know, Indigenous lands in general, which is like, again, is like using land as like a commodity and something that can be owned. We don't own the land, we are the land. So that is, you know, fundamentally different from how land is like developed and like urbanized, right? Just gonna move on so I don't have to look at this meme anymore. So I wanted to build from the book Sacred Civics, Building 7 Generation Cities. This book is really grounded a lot of like what I think about when I think about like urban Indigenous life in cities. This is available open access online, so highly encourage you to check it out. And I wanted to pull this quote, which is one of the first sentences in the book, where the editors write, "What if each person were seen as inherently worthy of dignity, empathy, respect, and a life of flourishing? And what if the infrastructures of food, transport, housing, and other civic, cultural, and economic systems were conceived to be in relationships of reciprocity with underlying natural ecosystems which are essential for all life?" Powerful, and just I'm gonna continue with this, but I really love this quote, and it's just like grounds so much of what I think as well. And going forward in the book, we read that cities at their core are built from our relationships to land, community, and place, transformed over time by how these relationships and their underlying values evolve. So when over time, during like the creation of the settler city, the relationship to land and community fundamentally changes now that land is seen as an extractive source. The idea, again, of like private property is fundamentally different from like Indigenous relationships to land, and how we build communities and support communities and have that relationship to place. You know, the creation of like private property and like the formation of the settler city in general is like having that like power dynamic over like the person and the property. So the importance of being grounded in an identity and place is especially important for urban Indigenous folks, whether we are on our own territories or away from our territories. So it's especially difficult for folks living in poverty or under other systemic harms, especially for folks with different intersecting identities, to have that sense of being grounded in a place when we can't access so much of what cities should be providing for the community, as well as that like fractured relationship to the land as like the city is developed and as like nation building takes place. To know and understand a place, especially, and to be grounded in that like identity, is to know the memory, the stories, the protocols, and the ongoing stewardship of the land. So especially for Indigenous folks who are away from our territories, I think a big part of our healing is to still have like connections to the land wherever we are, but also understanding like the stories and the protocols of the land, which may be different from, you know, our own homelands, and also just thinking about like how we can still receive the medicines of the land and have that connection to the land, but also being good guests and stewards and follow the protocols of the land, so that we can help heal the land and the land can help heal us. And lastly, I love this point that our ancestors are the original city planners. Cities existed well before colonization. And a lot of cities have just been built based on, you know, like villages or settlements that did exist in Indigenous communities, and have basically just like been built upon that, because, you know, our ancestors are very strategic about like where villages and settlements ended up being in order to have like easy access to what we needed to sustain ourselves and sustain our communities. So, you know, that definitely got taken advantage of by, you know, settlers who were building cities, and then the displacement of Indigenous folks from that city also created like poor health outcomes, because we were literally disconnected from like our access to resources and like sustainable and things that sustain us, right? For folks who are familiar with Winnipeg, as an example, I say like as a Manitoban, if you know the intersection of Confusion Corner, if you don't know it, Google it. Just Google the sign. You'll see what I mean by Confusion Corner. The creation of Confusion Corner is actually the result of Winnipeg implementing like a grid system of the city on top of like traditional like roadways, essentially, that Indigenous folks within Treaty 1 used to get around, which were not like, you know, a grid system. So yeah, Google Confusion Corner. You'll know what I mean by how strange it is, but it's literally the result of like imposing a like grid system like on top of like basically a city that already exists. And within these territories in particular, there are so many examples of like cities and villages that have existed here since time immemorial, but have faced the impacts of urbanization and development, and especially like the extraction of our ancestors and our kin from like burial sites and other culturally significant spaces in the land. So that is, I wanted to just like highlight a couple of examples here. These two spaces specifically, as told by the Musqueam, of you know, how these spaces are still very much part of the territory, part of Musqueam culture, part of Musqueam history. And as well, these two sites I wanted to highlight by the Squamish, and especially xʷməthkվəy, which is, you know, an area of the Downtown Eastside, specifically around the Crab Park area. And I think as well, I think a lot about Crab Park and its history and the ongoing reality that folks of, you know, the presence of tent cities within several parks around Vancouver, and especially in Crab Park, and the ways that like colonial policies around like urban planning and the use of parks have really fundamentally devalued life and the intentions and community that have been built in these spaces. So, you know, again, we see the ongoing displacement of tent cities from places like Crab Park, for an example, when Crab Park exists because communities wanted a real available beach. And there has been a lot of work over decades to ensure that, you know, there's access to green spaces in the Downtown Eastside, but then also that we have a space for community building and like real access to the land, like outside of concrete, within the Downtown Eastside. So that's a big part of like Crowd Park's history and like, you know, the ongoing work that happens here. But again, like the imposition of like colonial laws and bylaws around like what you can do in a park, who has access to like park space, especially on unceded territories, is like, you know, contradictory to all of this, right? So again, with all of this, I think about how we're so lucky to work with Chief Bill Williams as part of our elders and cultural team at Vancouver Aboriginal Health. He's a hereditary chief of the Squamish Nation. And I think about what he said before with us about how the land is under the concrete. So again, going back to the concept of like, you know, just because we're in a city doesn't mean we're not on the land. I think about this a lot, especially given like the history of the sites that are here, and how we can honor the history of what has happened on these lands, and how we can like revitalize cultural practices by honoring the history and protocols that are here. So now we're going to talk about land-based healing, finally. So rooted in tradition, ceremony, and ancestral knowledge, land-based healing, as like our working definition, refers to practices centered in Indigenous worldviews that recognize connections to land, culture, and all of our relations as integral to healing. And land-based healing can be anything that connects us to the medicines that the land provides, wherever we are. So in our work, we really tried to just like have pathways to culture and connection, regardless of where someone's from, where they're at in their healing journey, and like what they're interested in exploring as part of like their cultural connection as part of their healing. So we offer things like ceremonies. We really try to have an increasing focus on access to traditional foods and medicines, because that's especially hard within cities. We have like daily and weekly crafting workshops within our cultural programs. So we find that that's a really great entry point for a lot of folks to explore what it means to like practice culture and tradition, is through those workshops. Again, that overall like connection building and relationship building with our elders and our knowledge keepers, but also within community members, is really important to a lot of the work we do with like culturally grounded care and land-based healing. Again, like having like our counseling with our elders and having that like good talk is a big part of healing, especially when it comes to like our mental and emotional health. And sharing cultural knowledge and teachings and learning about the lands that we are on, I think, is really integral to the work that we do, especially for those of us like myself who are away from our traditional homelands. It's important for us to honor and know like about the lands that we are on, so that we can be good stewards and guests on these lands, but also, you know, ensuring that we can help our whole community thrive, rooted in like the protocols of the land, so that you know, we receive like the best medicines that we can and care for the land the best that we can, right? Because that's all reciprocal. So some recent and ongoing examples of what we do for land-based healing. In our organization, we offer monthly sweat lodges within the Downtown Eastside. We do a lot of like cultural sharing and exchanges. We had some knowledge holders from the Nisga'a Nation come in recently to do some cultural sharing through food, through song, which is really special for us. Our food canning workshops are getting especially popular too, because I think that's again a big part of living in cities is not having that access to traditional foods and medicines. So whenever we can offer canning, that ends up being very popular. Yeah, and some recent events that we did, in July, we did a youth puberty rights day camp. And one of the most special stories that came from that is that the camp was open to like Indigenous youth from any nation from like in like a certain age range. And during that, we did the camp at Brighton Beach, so not too far from here. And one of the girls there was like fairly quiet, fairly reserved when she came in, like not immediately like willing to engage, and was like, you know, just was holding back. And there was we did like a sweat lodge on the beach. It was a smaller and not super intense sweat lodge, mainly because this was also one of the hottest weeks of the year so far. And for a lot of youth, it was their first time at a sweat lodge too. But we were still able to like have the sweat lodge and sing and drum and pray within it. And that girl came out, and after being in the water afterwards to cool off and refresh and have that be part of the ceremony, she said that like she's never felt happier after that moment. And like that's what it's about, right? We also held a like competition style powwow at the Japanese Hall in August, which was really awesome. And we definitely outgrew the space right away. We're excited to expand that and have something bigger and better in an outdoor space, hopefully next year. We held our Sďwməthkվəy Indigenous Health Fair in Oppenheimer Park in September. You will see the photo of the salmon up here. This is all the bureaucracy we had to do in order to have our fire permit to do this. But we were able to roast salmon that our executive director got from her traditional territory in like the Mount Currie area. And we were able to roast and serve it on an open fire right in the middle of Oppenheimer Park. And that really, I think, was like the highlight for me being there, was being able to engage in all of our senses of sight, smell, feeling, hearing like the crackling of the fire, obviously tasting the salmon. We really wanted to like evoke all of the senses when it comes to like access to culture in whatever way that means to each person. So I think that was just like a really wonderful example of what's possible with land-based healing. And I want to give a shout out as well to our Indigenous Early Years team, who is a team of almost entirely Indigenous women who have amazing like family-centered cultural programming within their services. They are absolutely leading the way when it comes to like family-centered services, from like rooted in Indigenous values and perspectives of what it means to care for our youth and our future generations. So shout out to them as well. I just want to go back here quickly as well. Here are Ingrid and Elder Eugene xʷməthkվəy, who are part of our cultural team. Ingrid is our knowledge keeper who works specifically in the primary care clinic. She is our like point of contact for like intakes and for like cultural supports for people who are entering the clinic. And she also helps like make the connections between the clinic and the cultural program, which is upstairs. And her presence within the clinic has been completely transformational when it comes to folks feeling safer in our primary care clinic space, because we have that cultural presence. As soon as someone walks in the door, it's there immediately is that difference of coming in here versus like basically any other clinic, is because we really focus on that cultural aspect and that relational aspect right off the bat. So shout out to Ingrid. Ingrid is incredible. And also xʷməthkվəy does amazing outreach work within the community, as he's done for decades. We are so fortunate to have him on our team as well. So wanted to really highlight them. And here, so a lot of the values that we're doing with land-based healing, as I wrote here, of creating spaces to heal and thrive, right here, honoring and reclaiming the history of this neighborhood as a place of coming together to care for each other. this is really how we're trying to plan our new healing center that's coming soon. And what I also think about when it comes to like city planning from an urban Indigenous perspective is how can we really weave like culture and ceremony into the process of every step of developing this space. So we've held ceremony, we've had practices in like the design and development of our new facility and specifically like we've engaged with elders and knowledge keepers from the host nations when it comes to this process as well, to ensure that we understand the cultural significance of our site, that, you know, we are honoring the history of this area, and specifically in this neighborhood as well. What we know is the Downtown Eastside was really a crossroads of different villages to gather and so gather foods and medicines, and also like meet up for, you know, political conversations, and also just like ways of connecting with neighboring villages and also like other nations on these shared territories. So we wanted to like, again, honor that the history of the Downtown Eastside as a place of like gathering and coming together. So that's going to be a big part of like the services that we're planning, as well as just like the overall like design and intention of the space. So you'll see here that we're really trying to weave land-based healing into like the actual design and practice of our space too, to meet the needs of the community, because we don't have that ongoing like permanent access to ceremonial space that is like low barrier for folks. So that is like what we're working to incorporate within our new facilities, so that we're able to like offer that space. That's important to us there too. I could speak like tons more about our facility, but yeah, we are looking forward to it. Hopefully in like a year to a year and a half is when we are looking to open the doors. But yeah, this will be at the 52 to 92 East Hastings, coming soon. And lastly, I just wanted to end with a little bit of hope that better care is possible. And I know that we weren't really able to cover all aspects of, you know, primary care and the healthcare system and urban Indigenous health in general, but I just want to really close on the idea that relationships are medicine, and we need to move beyond this biomedical approach of what primary care means, because often primary care is, you know, like that first point of access, and then you get like, you know, constantly referred elsewhere based on like the silos and individual issues within your body. Whereas that we really want to like rethink primary care when it comes to like what is actually going to like help us feel well holistically, thinking about our physical, mental, emotional, and spiritual health using the teachings of the medicine wheel to guide us. That's what I mean by primary care. And that's what I want to rethink when it comes to primary care. And I think that land-based healing and cultural practices within primary care settings like is part of that path forward. Incorporating that sense of place, belonging, and acceptance is a major part of what we do. I've been wanting to, I meant to share this earlier, but we've had stories of, you know, folks who have accessed our Sgsmålodge for the first time and finally felt like they had that sense of like place and like identity within the Downtown Eastside, because they felt seen and supported in a way that they haven't been able to access before. And, you know, just when that feeling is extended to one person, then we know that that can extend to their extended kinship and their extended family and the community at large. Even if we just change how one person feels, that is a massive impact into what we do. And that's exactly why we do this work, right? Supporting the agency and the personhood of each person who comes to access care wherever they are at in their healing journey, ensuring that what we do is trauma informed in a real way. And a lot of that comes from folks who also have those experiences and that knowledge to share. I don't like the term peer support in a lot of ways, because I feel like peers within the broader system are often undervalued for the knowledge that they provide. But this is why we put so much value on like representation in terms of like our staffing, ensuring that like we have folks with like the lived experiences to really build those like that trust and that relational aspect of primary care that is missing from so many spaces. We want to think about care that is proactive, not reactive. So again, not focusing on like individual issues within our body, but really focusing on our whole wellness, rather than just like, you know, just certain aspects and silos of that. We want to provide care that is by, for, and with community. And that's been, you know, our intentions our entire time as an organization, but I still think that we have more work to do. I'm not saying that our work is perfect in any way. I think we're still figuring things out in a lot of cases. But what we really want to do is to not only be a better guest for those of us who are away from our homelands, so that we can provide the best care we have in the best way that we can, rooted in the protocols of these lands, but also work to become good ancestors and ensure that we are creating systems that will help our future generations thrive as well. Because to break those cycles that these systemic policy failures keep trying to snowball and continue, right? But everything can change. That's the thing with a lot of policies and structures that exist in this country, is that they can change. And I think that better care is possible when we think about primary care in a different way. And all of this applies to cities and how cities can be built, how communities can be built. I think urban healthcare is intrinsically tied to what it means to live in the city and the conditions of the city that we find ourselves in. So again, like healthy people lead to healthy communities and healthy cities, but then also healthy cities lead to healthy communities and healthy people. So, you know, there's all of that is tied. And I think that all of these values should be grounded in how we plan and like organize and live within cities in our individual lives, as well as like as communities and as collective. And that's it. I'm so grateful to everyone who stuck around, for one. So it makes me really happy to have been able to share the space with you. I'm hoping we still have time for Q&A. I went on longer than I thought I would. But be in touch with us here at any time. You are also welcome to contact me directly if you would like. I have my information there. And yeah, I will leave it at that for now. But again, hi, thank you so much for that. And I'm going to stop sharing.
Thank you so much, Marlee. That was great. I loved learning about everything, and I thought it was cool how you were showing the examples of how your organization is getting people out on the land, and the puberty ceremonies and the smudges and the sweats. And I thought that was really cool. We have a few questions here. I just have the first one here. Someone's just curious about the change from Vancouver Native Health Society to Aboriginal Society. What shifted? Was it just the name?
Yeah, so I can't really speak on the details on that. Like, this actually happened a few months before I started. So before I started working here. So I can't really speak on the details. I think part of it is because our acronym was literally the same as Vancouver Native Housing Society. So I think there was like a literal confusions when it came to like our acronym. We actually still come up to this issue every once in a while. So I think that was probably a small aspect of it. I think as well as that, I have personal feelings about the term Aboriginal. We've had discussions about like, when do we use Aboriginal? When do we use Indigenous? When do we use Native? Overall, people have different feelings about all of these terms. I think Aboriginal was largely chosen because it was aligning with a lot of like the other organizations within our communities. So thinking of like the Metro Vancouver Aboriginal Executive Council, which we are a member of, and the First Nations Aboriginal Primary Care Network, which we're also a part of, and just like, yeah, thinking about that as well. But I also use like personally, I use Indigenous as a way of like promoting like solidarity among Indigenous peoples wherever we are. I think also Aboriginal is sometimes used too, and maybe this is part of why it was chosen, because it is a term that is a little bit more like specific to Canada. So maybe it was like used to differentiate that way. I don't really know. I can't really speak on more details beyond that, but I think that's part of the context there.
I think that answered our next question. Our next question was, will there be changes in the wording from Aboriginal to Indigenous?
We discussed this in our strategic planning last year. Because we already recently made that name change, like I don't think there'll be plans to do it again anytime soon. But a lot of us do use like Indigenous is still used in a lot of our programming and services, like in our Indigenous early years team, as an example. But also, again, like I use like Aboriginal and Indigenous sometimes interchangeably, but also like they can both be used in very intentional and specific ways too. So it's a lot of it is very contextual. So again, I don't think you'll see us under a different name anytime soon, because it all like very recently happened. But we've had discussions about like what those terms mean, and ultimately like everyone has different relationships to those terms. I think what the biggest thing for us is just to ensure that whatever we are doing is working by, with, and for our community, specifically to address our health needs, our health aspirations, and like addressing colonialism and all of the isms that affect us, regardless of like what our name actually is.
Thank you. And then we have another question. The next question is, can we talk more about connecting to the land in urban spaces?
Oh, we definitely can talk. I mean, where to start, really? But yeah, just like something that we're trying to build on in our practice is just ensuring that people have access to cultural supports and ways of healing that move beyond just the clinical setting, and to like rethink our understanding of what healing can look like within cities, whether that is like physically being in nature or just having access to like the traditions and like practices that have been on these lands since time immemorial. And that can look different. That can be so many different things, right? What we're really trying to do is just like, because we know that like even just walking through the door of a clinic can be a massive barrier for a lot of folks. We're trying to move a lot of like our more land-based healing opportunities like outside of our space, but still within the community. So we've done things in Oppenheimer Park, we've done things in Strathcona Park, Brighton Beach is an example for our youth puberty camp. Our powwow was in the Japanese hall. So still places that are very familiar and might be more accessible in terms of like that standpoint for folks. Also, the thing with our facility as well is that we are in an old building. It is physically inaccessible when it comes to our cultural programs because we have the barrier of our stairs. We do have like, you know, we've made cultural spaces that are more accessible elsewhere, but like the reality is until we move into our new facility, like there is like there are massive accessibility barriers when it comes to our current space. And what we're moving towards, as I mentioned in our new building, is that we'll have access to indoor and outdoor ceremonial space, like that are like fully accessible to everyone. And that they'll also be like permanent and ongoing as part of the broader community, because that is so needed. and not something that like exists in the way that it should yet. So yeah.
Great. And then our next question is, in BC, our recent Premier Horgan recognized and affirmed and took a great bold leap and affirmed UNDRIP into law in BC, especially Articles 21, 23, and 24. Will this go a long way to change the healthcare system in BC for the better?
That's yet to be seen. Again, I think a lot of like funding and policy priorities depend on the government of the day, regardless of like what level of government that is. I do have some hope in what the city of Vancouver is doing when it comes to finally what it means to be more of a city of reconciliation. I think that the recent action plan that was released within the city in partnership with the Musqueam, Squamish, and Tsleil-Waututh, it seemed a little bit more committed to that more meaningful like government to government relationship within the context of like Vancouver specifically. That gives me a little bit more of hope, especially too because I think a lot of the work that needs to happen with like UNDRIP and other initiatives needs to start with the host nations and then build upon that when it comes to urban Indigenous folks as well. But we need to ensure that like, you know, things like UNDRIP and, you know, being a so-called city of reconciliation is also in like deep partnership and commitment to the sovereignty of the host nations. I think that's first and foremost. I definitely want to like acknowledge my privilege as like an outsider and guest to these spaces, and especially as well as like a white passing Indigenous person, and my ability to like, you know, access things like consultations and, you know, ongoing policy strategies are very much shifted by like my ability to access things like relative resources and education, because like I don't experience a lot of the same types of racism and discrimination as other Indigenous folks. So I also want to be like very clear about like, you know, my understanding of like what UNDRIP means, especially in BC, can be very different from a lot of folks, especially from folks whose traditional territories are in BC. I don't want to impose all of my own thoughts about like what UNDRIP means here, because like these are not my territories. So just want to be conscious of that too. But yeah, I haven't really seen like, I don't know, again, I talked about just like constant reporting and consultations and action plans and the bureaucracy and the siloed effect of like different, you know, ministries and like areas of, you know, settler society that work so separately from each other. And I have yet to kind of see that like meaningful commitment to real structural change within any of those realms, except for like some areas at like the local level, which I think is like, you know, there are positive directions happening there for sure, but still a lot more work to do.
Thank you for that. And we have a question here. Is there a good resource to start learning and reflect on our relations to the land on the Explain to Me like I'm five level? Sorry, that's a weird question.
No worries. I mean, when it comes to learning about the lands that we are specifically on, like seek out the knowledge that has already been shared, of course, by like the host nations that we're on. Absolutely, like, you know, learn about the host nations, learn about like protocols and practices on these territories, learn about the history of these territories, first and foremost, because we can't really talk about land-based healing in isolation from what has existed on these territories. And, you know, when we talk about healing on these lands and also being a good guest on these lands, like we need to learn and listen and honor what continues to happen here, so that we don't, you know, so that we honor everything and like work in a good way on these territories. And a lot of that is just like, you know, learning from folks who are here, who either like speak on behalf of their communities or have just like shared knowledge in other ways. I think that's a major starting point. So yeah, definitely like seek out that knowledge for sure in all of its forms. And I recommend also checking out the Vancouver Heritage Foundation website. There are a lot of like great resources when it comes to like the history of a lot of these sites too, in like a more like consolidated way. Like there's a lot of like links and things put together about like resources that you can access and things of the sort. The libraries will also have like really great collections sometimes as well of works from the host nations that you know, their libraries, go support your library. They're there for you. But yeah, definitely just like, yeah, seek out that knowledge from the host nations to think about like what land-based healing can actually mean here, right? So, and I'm like rambling at this point, but that's what I'm trying to get at.
No worries. And our next question is, do you have does VAHS offer webinars, training sessions, discussions to primary care physicians?
Not at the moment. I think this is something I'm definitely interested in exploring. I definitely like, it needs to involve like our broader team for sure. I think a lot of the work that we're doing within like the primary care network we're in, as well as like some of the other networks we're involved in as well, is that we're trying to increase like knowledge and like sharing around what it means to be like an urban Indigenous health space. So we're starting to have those conversations primarily within like our own networks, and we're looking into ways that we can expand like learning opportunities and training and things like that with like schools and, you know, other networks that are like kind of outside of us. I think we're still trying to figure things out, really. A lot of what we've done recently when it comes to like our puberty counts and things like that are things that we've done for the first time. And we're still also figuring out ways to evaluate what's going on in holistic ways, in strengths-based ways that are different from like conventional ways of like evaluating health programs too. So that's a big part of it too. So I think once we start to build those foundations, then that's something we want to explore and like really share with the community on like a broader level.
And our next question is, can you share a bit more about some of those land-based healing activities and the impacts on those who participated?
Totally. So not every story, of course, is like mine to share. So I'm just kind of being mindful of that as well. But yeah, like I shared a little bit about the person who was accessing our sweat lodge and found that sense of community and family. With that person in particular was facing significant grief from that spent years from the loss of their son and then the loss of their spouse. Their spouse eventually passed due to the grief of losing their child. I'll leave it at that. But that person ended up in the Downtown Eastside because of the ways that they needed to cope, faced levels of addiction in varying ways, ended up within the community not really feeling like they had that sense of purpose or direction. And after like accessing our sweat lodge, was able to kind of like feel that impact of like culturally grounded healing in a way that they didn't think they could access or experience because of like also disconnections from their own cultural identity, and just like having that sense of place and community that they didn't really feel like they had before. And that ended up they ended up being a more regular participant in a lot of our cultural programs and like helped out a lot too in our program. Unfortunately, this person is no longer with us. They made their way to the ancestors a couple of months ago, but we think about them specifically in just like with one impact of what land-based healing can mean to someone. And that's like a very specific story, but it's just like one example of like what that kind of impact can be, because we also think of like land-based healing can be a pathway to accessing like other services, whether they be more like medical services or like other forms of like programming that we provide. So it is one aspect of the work that we do, but we really see it as like foundational to what we do, and it's because of stories like that.
Great. We just have a couple more questions left. Is anyone welcome to the Sweats and other activities offered? How does one find more information on these activities and how to access the care available?
Totally. With the Sweat Lodge specifically, we offer them monthly within the Downtown Eastside. We are intentional about not advertising the Sweat Lodge broadly and keeping that really within the community, primarily because we want to ensure that like folks within the Downtown Eastside are the folks who are able to access it. We are working on ways to like expand our offerings of like ceremony and other land-based healing more broadly and more often, and that's going to really happen when we move into our new facility. And so that's part of it. So we're intentional about like not sharing that aspect too broadly, because we really need to make sure that like we're meeting folks where they're at and that it is most accessible to our community directly. With other opportunities, basically almost everything else is open to everybody. Unfortunately, with like our primary care clinic, we are experiencing the same thing that every other clinic is having, and that we are unable to accept patients at the moment, because we are at full capacity. Same with like, and that's the reality of healthcare in BC and so many other parts of Canada. It's just that like we are also struggling with that capacity, and we are hoping that will change in our new facility when we have more space and more opportunities to take on more physicians, more practitioners, and then leading to more patients. So unfortunately, like we can't offer like primary care access at the moment, but we can. Everyone is always welcome to our cultural program. Anyone can also access our dental clinic, and also like our Indigenous early years programs are generally like fairly open as far as like intake. They can operate on different schedules when it comes to their programs, but are still fairly wide open. Some of them are on wait lists. It just depends on the program. But you can keep up to date with us primarily on our social media, on our Instagram and our Facebook pages are the most updated ones. I'm the social media guy behind those, so it's when you see a post, there's me. But that's probably the best way to keep up to date with like things that are going on within our services, especially our cultural programming. So you can check out our website at vahs.life, and then you'll also find like access to our like social media stuff on there too. And I think also for the page for this webinar, there was also links to our social media on there too. So I would check us out there. And I'm hoping to also put together some sort of like mailing list or other form of communication to keep folks up to date in that way. That would probably be something that happens in the new year. And we'll put out some sort of call out when we're able to do that. Yeah, we're just some things we have to keep like very limited and like focused directly within our current patients and our folks within the Downtown Eastside, but then other things we can open to everybody. So yeah.
Great. And this person said, this is very complex topics, including the history, healthcare, and healing. When did you start to learn about these topics, and where did you get the information from?
Oh, it's hard to like pinpoint when. For me, I didn't grow up with like a lot of strong cultural connections like in my upbringing, mainly just because of like things not super being passed down in my family. I always, for me personally, I always knew that I'm Métis, but like didn't actually really know what that meant, especially because even growing up in like a very Métis city of Sælkirk, it was like there was still like that. I didn't really have that like understanding of what like culturally grounded healing really means, and like how that would benefit me as a young person, because that wasn't just like something I knew I needed or wanted at the time. So a lot of what I think about now really came from my education. And again, I've had that privilege of being able to like access education and resources because of like intersecting privileges in my life. So I learned a lot about like, like more social justice focused approaches to health and healing, and eventually was able to like make those connections to Indigenous health, and wanted to focus on Indigenous health, like more specifically, especially actually when like in the early months of COVID, when I was like kind of still figuring out what direction I was going in policy wise during my master's program. I thought I was actually going to go into like education policy specifically, because that was just like, that's such a big part of my heart. But ended up kind of switching to like more health policy and like public health related work, because I could see the compounding impacts of COVID and amplifying the already like present structural inequalities that are present. So I think that's like when I started to really ground myself more in this knowledge. And a lot of the knowledge I've shared today as well is really rooted from like the elders and knowledge keepers I work with. A lot of like, I don't claim any of this knowledge as my own, and I don't claim to be an expert in any of it. Again, this is just like from my perspective as a policy person, of like, where we're at and where we need to go and where I think we can go.
Okay, and our last question is, do you envision a space for emergency preparedness and crisis response planning fit into primary care and mental health wellness as part of the land back and land-based responses?
It's a big question. So I definitely want to like reconceptualize what it means to like do emergency response, because a lot of that is grounded in just like, I think a lot of primary care in general and healthcare in general is like reacting to crisis, and I want to think about like, being proactive, thinking about our whole wellness when it comes to primary care, as well as just like having more resilient communities and a more resilient society, so that like everyone is like protected and safe and secure in their place within the city, which is a big thing. So I want to think, I want to move beyond like the current understanding of like emergency response, and just like, ensure that we are building cities and communities and a society where we don't have to like constantly be in crisis mode a lot of the time. So I don't know if this really answers the question, because like I just feel like we're always responding to some sort of crisis, whether it's like, with an individual person who needs support, or just like systemic issues that we have to like, do what we can when it comes to those. But yeah, I just like, really for me, it's just about being like proactive, and again, like honoring the teachings and the protocols and the ways that the land provides for us, which includes land back, because the ways that these lands have been stewarded since time immemorial were emergency response in themselves, because everyone was cared for, no person was left behind in these cities before the cities that we understand, the cities that we see now, before those ever existed. We think about the cities before the city. In those cities, there was less of that need for an emergency response, because everyone was like secured and cared for and was able to like contribute however they could, right? So I want to think about that rather than constantly being in crisis mode, right?
And thank you for answering all those questions. And thank you to our panelists and to everyone for joining us today. And thank you so much, Marlee, for the amazing discussion. It was great to learn about Land Back and how you guys are implementing on the land resources for Indigenous folks, and also briefing us on a bit of the history of healthcare and for Indigenous folks. And yeah, so just before we end the webinar, I would like to bring your attention to our up and coming UBC learning circles. They'll just pop up here in a few seconds. So we have the warrior model with Dr. Ricardo Manhoman, and that's going to be on November 29th at 10 a.m. And then we have empowering Indigenous subject matter experts through research with Dr. Christopher Horsty. And that's on December 6th at 10 a.m. Pacific Standard Time. And yeah, sign up for our newsletter. The link will be in the chat. All webinars are free to sign up for on our website at www.learningsircle.ubc.ca. And thank you for joining us today. We look forward to seeing you all at our next Learning Circle. Live lived. Thank you. Bye-bye.
Thank you, Marcy, everyone. Again, thank you so much. I put some of my contact info in the chat. But otherwise, yeah, things will be up later for future viewing. I'm so grateful that everyone was here today. Again, thanks for everyone who stuck around too. So really grateful.